Thanks very much to Dr. Laird for sort of laying the groundwork for this talk. We saw from those results the outstanding patency rates that can be achieved in this level 1 randomized controlled trial evidence. But again, with these trials, particularly pivotal trials, they're carefully selected patients to enable good comparisons and a valid randomization process. But it doesn't necessarily apply to the real-world patients that we treat on an everyday basis. And I think the global registry data will address the effectiveness of drug-coated balloons in these patients. Obviously, there's still a considerable debate as to the safety endpoints, and I think that's being adjudicated currently. But as far as the primary efficacy endpoints, that can be addressed with this series of trials, really. I think, as we all know, peripheral arterial disease is increasingly common, particularly as the patient population ages. We've had significant limitations in treating patients with lower extremity occlusive disease because of restenosis, and obviously these trials are designed to address that concern. When looking at the global study for IN.PACT, it really took all comers as far as claudication is concerned, looking at in-stent restenosis, long lesions, total occlusions. It was a very diverse study that involved over 1,500 patients at 64 sites throughout the world. The data were independently adjudicated by a clinical events committee, and there was a data safety monitoring board as well, monitoring the results of the trial on an ongoing basis. And this sort of outlines the general architecture of this study. Here are the 1,500 patients. There's the long balloon cohort. In the clinical cohort, there are imaging cohorts, and I'm just going to go over the results of each of these cohorts individually. The primary endpoints were 12-month primary patency, and then safety endpoints were freedom from device and procedure-related adverse events. So looking at the in-stent restenosis, again, a significant clinical problem that we've encountered. I think, have been very successful in the past 15 to 20 years in getting these lesions opened up and restoring arterial flow, but restenosis has been a significant limitation. And these patients all had in-stent restenosis after prior treatment, so there you go, 100% in-stent restenosis. On average, pretty long lesions, 17 centimeters. Some were occlusions, some degree of calcification, but I think the main point of emphasis is that these were patients who have that predisposition to in-stent restenosis or intimal hyperplasia. And here you look at the primary patency rates, remarkable actually, almost 90% at 12 months. This is dramatically better than any previously reported studies dealing with intimal hyperplasia and in-stent restenosis. And as a consequence, the clinically driven target lesion revascularization rates extraordinarily low, freedom from that at about 93% at 12 months. So in summary, the patients with in-stent restenosis are difficult to treat. The 12-month patency and freedom from target lesion revascularization was extraordinarily high in this subset, and it really is a very efficacious treatment in terms of that primary endpoint. How about occlusions, total occlusions? Again, an imaging subset within this global cohort was studied, and these results have similarly been published. Again, lesion length even longer, 22 centimeters, almost 23 centimeters on average, and the length of the occlusion over 10 centimeters on average, a significant degree of calcification over 70%. So really challenging lesions, fairly typical of what we see in this challenging patient population. And again, very dramatic results at 12 months, 85% primary patency rate. So those are impressive results for these patients in maintaining patency after treatment with drug-coated balloons in the IN.PACT trial. And again, the consequent low rate of target lesion revascularization, freedom from TLR at about 90%. So very effective in these long segment lesions, again, lesions that weren't treated in the randomized pivotal trials, and a challenging cohort that we've encountered, and really a significant success with this therapy. When they look at an analysis of their complex lesions overall, again, it's sort of combining these groups, long lesions, in-stent restenosis, and total occlusions, again, with these similar endpoints. And here they are, and looking at both primary patency and the safety endpoints. And again, all these lesions are greater than 18 centimeters of affected vessel length. This just summarizes the number of occlusions and stent restenosis as we've sort of been talking about. But here's that mean lesion length. Mean lesion length almost 30 centimeters. So I mean that's essentially the entire superficial femoral artery and getting into the sort of P1 segment. And here we are at 12 months again, almost a 90% primary patency rate. So again, in these real-world patients with long lesions, high primary patency rates and very low rates of target vessel revascularization, freedom from TLR at 93%. So it's just sort of a summary of the trials that have been conducted and the cohorts that have been imaged and the results from them, and essentially is highlighting what we discussed. Here are these target lesion revascularization rates, very low, all under 10%, with the exception of this study that was right at 11%. When you look at amputation rates, almost zero. One patient in the entire cohort, essentially. Thrombosis rates also remarkably low for this treatment, so it can be done effectively. And as Dr. Laird pointed out, the attempt to avoid stenting and using only infrequent provisional stenting still results in very low rates of thrombosis within this population. So very safe therapy from that standpoint as well. So in summary, IN.PACT DCB evidence portfolio, the entire portfolio, shows consistent results in straightforward lesions, in complex lesions, in stent restenosis, long lesions, occlusive lesions, and calcified lesions. And it highlights the effectiveness of these treatments in our real-world patient populations. Thank you very much.